So I'm going to assume that most people who have made these videos did well because they were well prepared. Be honest with you, I'm just kind of on the fly. I've been putting off doing this for a while. When I decided to do what I am doing now is because I was scheduled to have something called PAP, flap surgery. It's using inner thigh material and blood vessels to reconstruct your breast after having a mastectomy. I think the difference between that surgery and that of the tug is you're not using muscle. So you'll use the tissue and the fat and the blood vessel to reconstruct. I have already experienced the abdominal tissue from my left side, so I have had both surgeries, both abdominal and the PAP. But curiously enough, I could not find any information. I couldn't find anybody's personal testimony, personal experience, video of having had the PAP flap surgery. So I thought, well, maybe I make my own. So the next person comes along, they can maybe gives them a little window and maybe expel some anxiety or help them become more prepared. But I probably will talk about both. So forgive me if I'm kind of all over the place. That's just my MO. And I'm not very good with the camera. So some people are really good and fluid with turning things around. I'm going to have to fight my own clumsiness. So hang with me here. I had my surgery completed, God, what date? That was 3 weeks ago. It will be 3 weeks ago. So I've had time to heal. I'm walking just fine. My tubes are out. And hopefully next week I'm going back to work. So just to let you know where I am right now. There are a few things that are for the PAP, and I'm sure for the tug, anything doing with the thigh and the butt, that I have discovered are very, very handy and nice. And almost I can't imagine what it would be like if they weren't. If I never found out about them. One of those is something called a gel seat toilet. Yes. This thing. It's a gel seat, and it will connect to your toilet lid. And so you won't feel like somebody took a ruler and beat the back of your legs every time you had to sit down. I cannot tell you, with the tubes coming, if they come out the back of your legs, how much that is uncomfortable when it comes to sitting. So that's that. I also love these. I put these in the backs of my legs too, to help me with after the drains are moved. Don't do it before the drains are moved. But when the drains are moved, I put these in the backs of my legs where the drains were, because they will leak. This looks like a mess here, but this is my hangout spot. You want to make your hangout spot. I have to move this around because the dogs do not do what they're supposed to do. They're not supposed to get on this side of they're only supposed to stay on brown. You have a color system. There's your blanket, and this is mine. So anyway, I put a big old pillow here for my knee. I stack these up so that I can lean against them and that I don't put pressure on my backside or the drains. I also put a towel there because, again, you're leaking. And while you have the drains in, you're going to leak. There's nothing to stop it. So the towels keep the drainage from going into your furniture. Bicycle shorts. My doctor didn't like the idea of me using ace bandages. He says they fall off, they get nasty. He didn't like that. But then I brought up to him bike shorts, which I'm wearing still. And he said, "Oh, that's a great idea." And I'll tell you what, those bike shorts help you move out of bed, so that your incisions and your tubes don't catch as much when you're trying to get up. Okay. You'll need a wedge pillow, which you would need with both surgeries anyway, because you're supposed to sleep at 45-degree angle. If you don't have an electric bed, that is good to have. You get a wedge pillow. You also need a pillow to go home with. When you drive home from the hospital, that's for both surgeries, you put that pillow over your chest, put the seatbelt across, so that if anything happens, you slam on the brakes, that seatbelt doesn't go across where you just had surgery. See, these things, MD Anderson, that's who took care of me, gave me after my surgery. They're called, and there's also some antibiotic ointment they gave me too. And these are called Safeties. Oh goodness, I can't even read that. My eyes get really weird after surgery. I can't, I don't know why. I'm gonna get my eyes back soon, but these strips here, and that's the antibiotic ointment. But these strips you cut and you place them across the surgical site, and it just keeps things from rubbing, irritating. Oh, I love them. I have extra, so I'll keep on using these until my delicates are all better. So another thing that comes in handy, one of the things they'll give you too is these cups, and they're measuring on them. So you'll be doing your drains, stripping your drains, and putting them and dumping in these cups, and cataloging how much every day with the total. They keep track of that because they decide whether or not your drains can come out. You know, if you're not overproducing. And then they'll give you these alcohol wipes to strip the lines with, and then clean the tips off with, so they're nice and clean. So I had the and then I have curly hair, so you can't lift your arm that you had the surgery on. If you had a double, then you can't lift either arm. So my dominant hand is my right hand, and that's the hand that I use to comb my hair, and that's the hand I use to brush my teeth. And I'm not supposed to do repetitive motions, and I'm not supposed to lift my arm. And here I have curly long hair. This saved my life. I don't have to comb hard. I can pick out my hair and I can get it back, and I use a little bit of, you can use any oil, but I use this oil, hair oil. Just a little bit of my hair. It helps it loosen up, helps it let go, so I can deal with those knots from when I was in the hospital. And so the only time you ever drop anything is when you can't bend over. So with the PAP surgery, you can't bend over for a little while. So these little grabby, believe it or not, grandma's grabby stick. Yes, get one. You won't be laughing. Because you're guaranteed to drop everything, because that's just how the law works. So get a grabby. I use hot dog tongs sometimes too. You know, if I can't find my grabby, it's like I know where the hot dog tongs are, and it helps me reach for things. Back to the toilet seat again. I'm short, so getting to the toilet is not a problem. Gel seat again, cannot stress that one enough. But if I were taller, getting down to the toilet seat would be a thing. And so, you know, think about your height, think about what makes you comfortable. You may want to get one of those toilet seats that fit over, you know, the medical chairs that fit over the toilet to give you height. Put your gel seat on that so you can save yourself from feeling like your stitches are going to go, okay? Because there are a lot of things that are restrictive for a little bit. But unfortunately, your body reacts the way it does. You're going to have to go to the bathroom. So you know, consider that as well on your list of things that you may or may want. Also, with that, the right hand idea, or the dominant hand, brushing your teeth. I went to the hospital with a manual toothbrush, and without thinking, I started vigorously brushing with my right hand. I could not brush to save my life with my left hand. But this was not a safe thing, a good thing for my arm. I missed my electric toothbrush. Electric toothbrushes are awesome. If you don't have one, get one. It'll help you with not overusing your hand. It'll get your teeth nice and clean. But also it's good for you anyway, as far as oral hygiene. If you like to floss, they have, I forget what they're called exactly, but they're long-handled floss holders. You can do that so you don't have to reach so much or have to fight so much. Okay, just little easy things. Another thing I brought with me, I have dry shampoo and dry soap. I got from the medical store, because sometimes there are days when you're just exhausted. You know, you need to clean yourself, but with all the drains and whatnot, you're like, and so this was my cheat. So I have dry shampoo and dry soap also for those moments when, you know, I'm not going to fight the shower. And, you know, bring little cloths with you to the hospital. Charging cables, really long charging cables are a good idea if you're going to the hospital. Make a list of medications and when you should be taking them so that you can keep track of everything you're taking, and when you need to take the next. So hopefully you can ask the hospital, when's the last time they gave you your last dose? This is upon leaving. Now, NB Anderson gave me a pre-printed form that I was able to just simply, and it was typed on there, the last dosage they gave me and when the next dosage should be, so that I could keep track of it on there. But if your hospital doesn't, set yourself up one so you can keep track, because, you know, there's a lot there and you don't want to end up by hurting yourself. Let's see. As far as healing goes, I felt that in some respects, the PAP was easier. It was harder getting out of bed because of the drains on the backs of the legs. I think that was the biggest thing, is the drains on the back of the legs. The most uncomfortable part of it, that is. But moving and walking, not a problem. The abdominal tissue type surgery, that was harder for me. Not getting out of bed was easy. Well, not easy, easier. But you're supposed to walk. You're supposed to move for your recovery, to keep you from having blood clots. Your back was not meant to hold your whole upper trunk up. But unfortunately, you can't stand up straight after that surgery. They give you an abdominal wrap. I've used it since. I've used it a lot, because it also, there are times when, you know, my nerves are all reconnecting, and, you know, there are times when, you know, I don't know, it just seems to help to wear that now, currently, not all the time, but there are days. But with walking, you know, your back spasms, it is very unpleasant. You feel as though you're not supposed to be assigned to the couch. You're not supposed to be assigned to the chair. You're not supposed to be sedentary, but you feel like you're sentenced to being sedentary because it is just a chore. So what did I do? I got a walker during that time, and oh yes, get a walker. I know it's a lot, but you know what? Do what you can to make your life easier so you can get back in the swing of things, because there's an emotional angle to all of this. There's an emotional angle in how you're dealing with the fact that you're running with your life to get away from cancer. You're trying to get rid of it in every way possible, and your life has changed. Everything's changed. So much has changed. It's almost like you're experiencing a wake of your own death, which is not true, but it feels that way. And when you have freedoms taken away, and when your body doesn't work the way it was, I don't care if it's only for 3 weeks, it can start getting very dark. So you want to try and make as much of your life routine as it was before, at least to me, as possible. So as much as can make me or provide for me to be mobile and up and going, the better. When I'm in a bad place is when I'm sitting and like I'm not doing anything. I'm just sort of giving up. So try to stay active, but not too active. I mean, go within the guidelines of your doctor. Due to fluid buildup, you got to be careful about that. You will get to that point where you can do everything like you did before. It's just that in between of following medical directions and not sitting out, not just hanging it up and giving in to discomfort and inconvenience. Anyway, hopefully that helped some of those things, and good luck.